Okay, so this is my copyright notice. So I'm Jacob Scholand, and for my project I did type 1 diabetes. So just a little introduction on type 1 diabetes to who has it. So about 3 million Americans each year suffer from type 1 diabetes. Out of everyone who has diabetes, it's only about 5%, but it's still a large amount of people, so it is a major issue right now. The average diagnosis of people who get diabetes is usually between the ages of 13 and 18. That early teenage years is when you start to develop the most symptoms of it. You can get it later, you can get it earlier, just depends. But yeah. Okay, so type 1 diabetes is an autoimmune disease. So what our immune system does, basically, is its job is to kill anything that's foreign or harmful to our body, just to ward off viruses, bacteria, other infections that we get. So it keeps our body healthy and disease-free. So what an autoimmune disease is it's a disease that our immune system recognizes as foreign or unfriendly. So our immune system immediately attacks it, and it's part of our system, so it's not supposed to be attacking it, and it's not good for our body. And that's kind of how it works, and that's how it works with type 1 diabetes. So the human pancreas, what it does is it creates insulin-producing beta cells, which secrete insulin, which we need. The insulin-producing beta cells keeps our blood sugar. The insulin from that keeps our blood sugar at a stable level, and so our blood sugar isn't too high, too low, whatever. In type 1 diabetes, the human autoimmune system sees the beta cells as harmful and destroys them, which makes it so that we can't have any insulin in our system because it's destroying the cells which create the insulin. Because the immune system destroys the cells, the body cannot produce the insulin needed to regulate the blood sugar. Okay, so what is type 1 diabetes? So in a normal functioning pancreas, after eating, a pancreas releases a certain amount of insulin into the bloodstream in order to keep your blood sugar at a stable level. The insulin acts kind of as a gatekeeper of the cells and only allows a certain amount of glucose into them at any given time, and that's what helps keep it at a normal level. So it sends out the insulin. If you have enough blood sugar in your system, then the insulin does not allow any more glucose into your cells. So another thing that aids in diabetes is your liver. So what your liver does is your body produces glucose, and your liver stores it in the form of glycogen, and it's there as an excess in case your blood sugar is low. So say you've been exercising or just working out in general, your blood sugar tends to drop in levels, and so what happens is your brain can sense this, and it sends a message to your pancreas to tell your liver to release glycogen in the form of glucose. So basically triggers your liver to release the glucose in order to raise your blood sugar back up to a normal level. And this is just what happens, it's needed. So you kind of have your pancreas secreting insulin so that it can lower your blood sugar if it's needed, and your liver be able to bring sugar out in order to raise your blood sugar as that is needed. So it's kind of a balance. So in type 1 diabetes, the problem is that your immune system is killing off the beta-producing insulin cells in it, so your pancreas stops creating these cells, and your body is unable to produce insulin. Without any insulin, the person's blood sugar can rise drastically and can be life-threatening. Okay, with a type 1 diabetic liver, when type 1 diabetic pancreas is not able to produce insulin, the liver is not able to store any of the glycogen. When the liver is unable to store any of the glycogen, the body's sugar can become too low, which is also life-threatening. Okay, so factors that are contributing to type 1 diabetes. Now, none of these have been proven necessarily. They're then thought of like what could be. It's what doctors and researchers have said are possibilities. So the first one is where you live. So some of these sound odd, but people further away from the equator have a more likely chance of developing type 1 diabetes, as well as people who live further north have a greater chance of acquiring the disease. There are viral diseases that have been connected to type 1 diabetes, and studies have shown that there's a higher risk of getting the disease if you have one of these viral infections. Scientists believe that these diseases trigger our immune system to kill the insulin-producing cells, and doctors also believe that this disease could infect the insulin-producing beta cells, which could cause our immune system to attack it. Okay. The other thing that has a factor in contributing towards type 1 diabetes is a person's diet. The things that could decrease your risk for type 1 diabetes are vitamin D and omega-3 fatty acids, while things that have been shown to increase your risk for type 1 diabetes are drinking milk at an early age, drinking water with nitrates in it, and introducing cereal to a child's diet at an early age. And all of these are possibilities and have yet to be proven true. Okay, so symptoms of type 1 diabetes. So these symptoms are heightened thirst, frequent urination, unusual hunger, weight loss, loss in strength or fatigue, and blurred vision. So heightened thirst and urination is caused by large amounts of sugar which is in your bloodstream, which pulls the fluids out of your body, which causes you to have more frequent urination and to be more thirsty. Extreme hunger is caused when energy cannot reach your body's muscles. This is because insulin helps carry energy from the food into the muscles. So when you're not getting any energy to your muscles, your body's natural reaction is for you to eat more food. And if you keep eating more and no energy is being produced, then you are constantly feeling hungry. Weight loss can happen because when your muscles aren't getting any of the energy from the food that they need, your body begins to eat away at your muscles and extra fat and tissue in order to get the energy that you require to just do your daily activities. And basically, so you start to lose weight as it starts.
So your body actually breaks down its own muscle as fuel?
Yeah, it'll break down its own muscle and fat as fuel, as there's no insulin creating energy to the muscles. And loss of strength and fatigue is caused by cells not getting the sugar, which can cause you to be tired and lazy feeling. Blurred vision, like heightened thirst and frequent urination, is caused by high blood sugar pulling fluids out of your system. So basically what it's doing is it's pulling the fluids out of your eyes, and it's causing your vision to become blurry. Okay, so blood sugar. Everything that a type 1 diabetic does has to be revolved around their blood sugar, because that's what the cause of the problem is. It's because you don't have the insulin needed to regulate your blood sugar. So the first step is checking your blood sugar. So what you do usually is you prick your finger, and I don't have a test strip here, but this is a vial of them, and you take it out. It's about 30 microliters worth of blood, and you put it into a test strip, and you put it into a sensor right here. And basically what it does is it will read your blood glucose meter here, and I'll pass these around so that you guys can see them. But basically, when you get your monitor and you put the blood in, it will give you a certain amount, so it will say something like 140 mg over DL, which would be 140 milligrams over deciliters. And the milligrams over deciliters is the amount of sugar in milligrams per deciliter of blood in your system. So methods of insulin delivery. So the first method that most diabetics, type 1 diabetics, start out at when they first become diagnosed with the disease is they intake shots of insulin. So basically what it is you have a vial of insulin, and I have one here, And you basically place it into here, and you put a tip on it, and you are able to get the exact number of units of insulin that you would like to inject yourself with. To calculate the amount of insulin you want to inject yourself with, they have a carbohydrate conversion. So for so many carbohydrates in a meal, you inject yourself with a certain amount of insulin. Now, there are two different types of insulin. The first type of insulin, the one that you would have in a meal, is called Humalog. It's fast-acting insulin. So basically, when you take it, within 15 minutes, it starts to work, kick into your system, and it begins to regulate your blood sugar. The other use for Humalog is if you needed a blood sugar correction. So if your blood sugar is higher than the recommended amount, say you're at like 200 milligrams per deciliter, which is pretty high, you would take a certain amount of insulin in order to counteract your high blood sugar and bring it down to a more stable level. The other type of blood sugar is called Lantus. Now, Lantus is it's a slow, long-term acting insulin that you usually take at night. It's most effective for 10 hours, but it can last up to 24, and it keeps your blood sugar at a stable level, usually while you're asleep, so your blood sugar doesn't go through spikes or decrease throughout the night. Yeah. Oh, okay. So I'll pass this around. This is what a Humalog container would look like, and I'll also pass the insulin pen around. Okay, so the next thing is an insulin pump. So what an insulin pump is, it's a small device. It's right here. And basically, it's a catheter that injects into the skin. And you have what's called a PDM right here, or a personal diabetes manager. And what you do is you basically can check your blood sugar, you input it into the PDM, and it will tell you if you need to take a correction. It will basically tell you if you're eating. When you have a certain blood sugar inputted, it will tell you how many units of insulin you should take while you're eating. And so, yeah, the catheter just goes under the skin. You can program it to deliver a certain amount of insulin, and it will just inject it directly into your body without actually having to take a shot. Because there's basically like a little needle within the catheter that just shoots into your skin to poke a hole, and it injects the insulin. So what's good about this is it's able to regulate your blood sugar for younger children mainly, because with shots it's really hard to keep a stable blood sugar just because it's new to them. So what this does is it's easier to track your blood sugars and able to control it. Now, another type of insulin is called, or another type of delivery device is called a pod. It's very similar to a pump. It's this right here. So, unlike this one, you have a PDM, or personal diabetes manager, that's separate from the actual pump itself. And what's nice about the pod is that it sticks right to your stomach right there, and it's like it has a catheter that shoots into your skin and will deliver it. But with the normal pump, you can't do things such as take a shower with it on, go swimming. You can't get it wet, you can't damage it, because you actually have the control of it right on you. Where if you have a pod, you can have a PDM outside of you, which you can't get wet, but you can have a pod on you, which can get wet. And all that's doing, it basically is receiving signals from the PDM, and it's telling it what to do. So, say you input your blood sugar levels into the PDM, it will basically can tell the pod, like, based on that, how many units of insulin to deliver during the meal time. For a blood sugar correction, it will tell the pod how much insulin it should deliver. That type of thing. Yeah, Nathan?
So, since we're dealing with technology here, there's always like technological malfunctions. So, what would happen if the PDM told the pump to inject too much insulin? Like, can you overdose with insulin?
The only malfunction that I know of is that a pod or a pump can fail. I've never heard of it actually delivering too much insulin to someone's bloodstream. But what can happen is a pod will just have a malfunction or a failure, and basically